Today's topic is a rather complicated one and one that I'm going to try and be succinct on. It's about what is bipolar disorder. There's lots of good information on the web. There's also a lot of bad information, but typically the good information is the information that kind of agrees with one another. Bipolar disorder is traditionally identified as two polarities. You have manic behavior and you have a depressive behavior. And when I explain that to individuals, it usually involves a discussion of what each of those look like. And again, there's information on the web to describe what that is. But another way that I describe it to people is that your brain is essentially full of lots of different highways. And on these highways, there are different cars that are traveling. Bipolar disorder is associated with certain types of these cars carrying certain messages in the car from one location of the brain to another. Now, one thing that makes bipolar disorder so very difficult to diagnose is because you can't really centralize it or localize it in the brain. It's a very global, systematic presentation. So as much as we would like to say, there it is, let's impact that part of the brain, we really can't. Moreover, a lot of the symptoms that we try and listen for during a clinical interview can often be confused with other problems, such as a personality disorder or attention deficit, or just regular unipolar, or what people commonly know as major depression. But let's be very clear here that it's the presence over a certain amount of time of manic behavior or excessive behaviors and depressive behaviors. Let's start first with depressive behaviors. The symptoms you look for in depression are the same symptoms you look for as someone who has major depression. However, those symptoms are going to show themselves different. For instance, sleep interruption. Someone with just regular depression may end up sleeping less, which is a disruption nonetheless, sleep less, and when they wake up, they may be in a worse mood, and then their mood improves throughout the day. Whereas someone who has bipolar depression, they will end up sleeping more with more fatigue, and they will wake up in a better mood, but their mood will worsen throughout the day. So it's kind of on the flip side. Again, same symptom, just presented differently. Individuals who have bipolar typically have suicidal ideation, about 20% of the population, whereas individuals who have major depression, just about 9% of the population. There are also some nuances in how some other symptoms manifest, but that would be something for a treating physician to cover with you. On the other end is this presence of manic symptoms. Now, this really is interesting because imbalance in the circadian rhythm really accounts for a lot of what people see as mania, excessive behaviors like spending, hypersexuality, staying up all night, things of this nature. So when I say the circadian rhythm, we all have different ways that our biological clock gets regulated, the rising and setting of the sun, but there are internal biological mechanisms too, like our body temperature, like secretion of hormones, respiration rate. These kind of signal to our body. In individuals with bipolar disorder, this is off. And interestingly enough, one of the primary medications designed to treat bipolar disorder, lithium, actually lengthens that circadian rhythm. So it helps get the body into a regular cycle. And that's important because a lot of triggers can induce a manic phase. Anything from crossing from one time zone to a next to drug use. So to be clear here, bipolar disorder is very complicated. It's usually marked by a certain period of manic behavior and depressive behaviors. A skilled clinician will be able to kind of tease out if whether or not there's something else going on. Interestingly though, bipolar disorder is one of the few illnesses that I find people want to have. And when that is the case, it may be a red flag that something else is going on. While individuals may enjoy their hypomanic or manic states, I've never found a patient who's been accurately diagnosed that wants to endure the depressive phases. Suicidal ideation, as I mentioned, is much greater, it's much more difficult, and even though it can take 10 to 12 years to actually get them at a right diagnosis, once they have it, they're very appreciative, and they kind of learn to let go of the missing the hypomanic states, as grand as they may be when they have them. you have any other questions on this topic, which I hope you do because it's a very complicated one, just be sure to leave a comment below.